Okay, we're getting back into our cardiovascular system. Remember, we talked about the blood previously, one of our three components of our cardiovascular system, the other two being our heart, that we'll talk about here in this lecture, and then our blood vessels that we'll be getting into next week. We took a little detour from our cardiovascular system, talked about the lymphatic system, which is very tied in and correlated with our cardiovascular system. So it wasn't a big detour. A lot of overlap with regards to stuff associated with the blood, especially, and that's kind of why I like to talk about those back to back. But now we'll be moving on from our lymphatic system and getting back to the cardiovascular system. So we're focusing in on one organ here, our heart, which can basically be thought of as a muscle, the main muscle responsible for pumping what we call deoxygenated blood to our lungs, oxygenated blood to the rest of the body. Must be constantly to circulate our blood through our body's blood vessels so it can reach our body cells and exchange materials with them. To accomplish this, here's some pretty wild statistics. The heart beats about 100,000 times a day, adding up to about 35 million beats per year, and in a lifetime about 2.5 billion. It's an incredible number, considering, you extrapolate that out. That's a lot. So obviously, we all know this. Hearts are super, super important. Size-wise, it's about the size of a closed fist. Next week, when we have lab, we're going to dissect a sheep heart, which I've mentioned before. It's about the same size, so pretty good comparison. About 12 centimeters or 5 inches in length from top to bottom, 9 centimeters or 3.5 inches wide at its broadest point, and 6 centimeters or 2.5 inches thick. Weight is about 8 ounces in females and about 10 ounces in men. Located in a region called the mediastinum, which we've learned before. Mediastinum is that anatomical region extending from our sternum to the vertebral column. It's also going to extend from our first rib down, and then it's between our lungs. Now, you were introduced to this at the beginning of the semester, very first lecture. We learned the terms base and apex, or basal and apical, which refer to kind of triangular shaped organs like our heart. It's not a perfect triangle, but it does have kind of a triangular shape, demonstrated really kind of down here at the bottom, where the point, what we call the apex of the heart, is kind of at the bottom, not a perfect point straight down, because it actually points from our right shoulder down to our left hip. So kind of down towards the left side of our abdomen is where the apex points, which you can see nicely here. The base, as it states here, is the posterior surface formed by the chambers known as your atria. So not only does your heart sit at an angle side to side, it also sits at an angle front to back. It's hard to kind of illustrate this, but if I just turn myself sideways, I know if you're watching on Zoom, you can't see this, but your heart is tilted backwards at the top, and the front point, your apex, points forward. So in our body, it sits not straight up and down, but at that kind of awkward angle, pointing backwards, which is why here in our anterior view, you don't show the base, okay? We would have to show a posterior view to show the base, which we have a posterior view that we'll look at here in a little bit, okay? Whereas the apex, you can see it's the tip of the left ventricle resting on the diaphragm. We've got some different surfaces. I want to talk about. The anterior surface is deep to the sternum and ribs. The inferior surface, shown right here, is going to run from the apex to the right surface or right border, and it rests pretty well, nice there on the diaphragm. Your right surface or border, as I just mentioned, faces the right lung, extends from the inferior surface to the base, and then left surface or left border faces the left lung, extends from the base to the apex. Now, as far as this picture goes, it's not my favorite picture, but it does give you an idea of kind of the location and some of those parts that I do want you to know. So everything that's already in all caps there for you is what I would highlight. I don't care about these pictures at the bottom, although it's kind of nice to kind of have an idea where your heart is located in relationship to kind of your chest, the midline. You can see majority of your heart is over here on the left side, all the way over to about that midclavicular line over there, almost by the left nipple, as we show there. Okay, so that's just kind of just general features and location of our heart. We'll start on this page really getting into the anatomical parts of the heart, starting with something we learned about once again back in that very first lecture, the sac that encloses our heart, what we call the pericardium, which is actually a two-part sac, including a fibrous pericardium, the outer layer, and then a thinner, more delicate inner membrane called the serous, and which is actually made up of two parts, a parietal layer and a visceral layer. We talked about the parietal and visceral layers back in that first lecture when we first introduced serous membranes. We also have two other major serous membranes, one that is around our lungs. We call that the, anybody remember? Pleural. So in that case, pleural, always remember, refers to our lungs. And then there was the peritoneum down in your abdominal pelvic cavity. So we'll talk about the pleura here in our next unit when we start talking about our lungs, but not yet. Now we'll just focus on the pericardium. You see the kind of root of each of these words, cardiac. Remember, anytime you see cardiac, it refers to the heart. You see it all over the place on this slide. It includes these three layers that you're writing down right now, along with the pericardium that I mentioned at the top. So let's talk about the pericardium first. It's a loose-fitting, inextensible sac, so it doesn't really want to stretch. Two parts making it up are the fibrous pericardium, which is the thinner, or excuse me, the thicker outer layer, made up of tough, inelastic, dense, irregular connective tissue. Inelastic means it's really resistant to stretch. Dense, irregular connective tissue tells you that there are collagen fibers running in all different directions, so it can withstand stresses that it experiences whenever the heart fills up. Covers the entire heart, but only forms attachment at the greater vessels, which include like the aorta and the pulmonary trunk. You can see some of those here on this previous page that are on the top of the heart. It acts to anchor the heart to surrounding structures and to prevent our heart from overstretching. Deep to that is the serous pericardium, the more delicate membrane forming a double layer around the heart. And this is really what we talked about back in that first lecture. The two layers include a parietal layer, outer layer that's fused to the fibrous pericardium, and then the visceral layer. Remember, viscera refers to internal organs. In this case, the visceral layer is what's actually on the surface of the heart, and it actually is one of the layers of the heart wall, which is why in parentheses we have the term epicardium, which you had to write down there at the bottom. Function of the visceral layer is just to adhere tightly to the surface of the heart. Between those two layers is a very fine, small space called the pericardial cavity or pericardial space, which is full of a fluid called pericardial fluid. Thick serous fluid to provide a slippery surface, enabling lubrication and preventing those membranes from kind of having friction between them. So it's a very slippery surface. Infections, inflammation can cause friction in the pericardial surfaces, resulting in severe pain. Anybody heard the term pericarditis before? Pericarditis is something that you hear a lot of, like if you watch, TV shows about medicine, House and Scrubs and Grey's Anatomy. Also movies, you'll see it a lot of times. Pericarditis, anytime you have itis at the end of the word, it means inflammation. So inflammation of the pericardium. You can actually get blood that fills that pericardial space called pericardial tamponade, which requires surgery to relieve the pressure. It'd be very difficult to fill the heart up with a lot of blood, with that blood in that space pushing inward on the heart. So very, very dangerous. Also probably very painful. Okay, let's talk about the three layers of the heart wall. I've already mentioned the epicardium is also known as the serous pericardium, the outer layer of the heart, made up of mesothelium, which is a form of epithelial tissue. Also, delicate connective tissue, which imparts a smooth, slippery texture to the outermost surface of our heart. Looking at our figure here, you can see the kind of thin white line right there. That's the visceral layer of the serous pericardium, or in parentheses, the epicardium. Deep to that, the very thickest layer of the heart is the myocardium. Anytime you see the prefix myo, I've mentioned this before, that means muscle. This is where that cardiac muscle tissue is located, made up of myocardial cells, which are just the fancy terms for, is the fancy term for our cardiac muscle cells. Those muscle fibers are going to run in a coordinated way, like we show here, creating swirled layers of muscle that envelop our heart. So when we contract, it squeezes the chambers empty. Like, you know, if you think of like milking a cow, it's going to squeeze the udder. That's what we're doing to the chambers when our heart pumps. Myocardium also consists of non-contracting structures known as Purkinje fibers, which are essentially the wiring of our heart, making it possible for nerve impulses to travel throughout the heart and thus causing them to contract. This is also the layer of tissue that can become damaged during what's called a myocardial infarction, which you may know more commonly as what? Anybody know? Heart attack. You know, fortunately, when a heart attack occurs, the muscles will die, and it's really difficult to, you know, have a functioning heart at that point. Obviously, not every heart attack kills a person, but it can be very dangerous and deadly, as most of you probably already aware. Deep to the myocardium, another thin layer called the endocardium. Endo always means inside. It is a thin, delicate layer that actually resembles simple squamous, so it's actually really, really thin. Remember, simple tells you that we're dealing with one layer of epithelial tissue. Squamous tells you that the cells are flat and plate-like. This is not only going to line the inside of our heart, but it also lines those four important vessels, the valves, and is continuous with the inner lining of our blood vessels, where we actually will call it endothelium, and we'll be talking about that next week. As far as the picture goes, this is the one that I want you to know. What's already capitalized for you will be what I want you to know, along with pericardial cavity, which is not capitalized. Make sure you also highlight epicardium there under the visceral layer of the serous pericardium. Go ahead and highlight at the top here the pericardial bracket, along with the bracket for the heart wall. We're going to talk about these little ridges here found within the ventricles called trabeculae carneae here in just a minute. Noticing that the inner parts of the inside of our ventricles are not just a smooth layer, it's, you know, rigid. We'll talk about why those are there. This picture over here on the right just is kind of like that picture that was in that first lecture where we used a balloon and a fist pushing inward, if you remember that picture at all. Kind of the same thing. The heart would be the fist pushing in on the pericardium. The layer that's touching the heart actually becomes part of the heart wall. Would be the visceral layer, excuse me. Surrounding that would be the parietal layer, and then between them would be the cavity that we show over here. I'm not going to worry about this picture. The only reason I included it is kind of show you the way that those muscle fibers run, creates that swirl that you see to help with moving the blood out of the chambers when the heart contracts. Speaking of the chambers, let's talk about those right now. All right, let's talk about the four chambers of the heart, each of which serves a specific purpose. The two atria are the two superior chambers, and the two bottom chambers are the two ventricles. The term atria is plural, atrium is singular. So you notice there we have like right atrium, left atrium, but up above, what you had to write down was atria. We call the two superior atria receiving chambers, and that's because they receive blood that's coming back to our heart by way of veins. We can describe the walls of the atria as very thin-walled, especially compared to the ventricles, and that's because you can think of cardiac muscle like skeletal muscle. The bigger it is, the stronger it is, or the smaller it is, the weaker it is. We don't need really thick, strong walls in our atria because all they do is pump the blood down into the two ventricles. So looking at the picture, it's kind of hard to illustrate. This is from a cadaver, but the right atrium, the left atrium are both thin-walled compared to the much thicker-walled ventricles. And there's a picture here. We can kind of really show it a little bit better. Atria walls thin, ventricle walls are much thicker. We'll get into all that stuff here in a little bit. Okay. Now, your right atrium is the chamber that receives deoxygenated blood from blood vessels that include our superior vena cava, inferior vena cava, the coronary sinus, all of which we'll talk a little bit more about here in a little bit at the bottom of the page. The term deoxygenated blood is a term I really don't like that much because it implies that blood that's coming back to your heart after it's run out for like your arms and your legs no longer has any blood or has any oxygen in it whatsoever. Right now, we're only pulling out where we're at a resting state about 25% of the oxygen from our blood. When we are in a maximal exercise state, we pull out more oxygen, but never is blood coming back to our heart completely devoid of oxygen as long as we're continuously breathing. Okay. So deoxygenated blood, something I don't like, but that's what we use. So we'll just go with it anyway. Between the right atrium and the left atrium is a wall called the interatrial septum. Remember, inter means between. So interatrial means between atria. Septum is just a fancy word for wall. Okay. And there's a special feature that you find in the right atrium. Along that interatrial septum is what we call the fossa ovalis, which is the remnant of a hole called the foramen ovale, which is a hole that's found in a fetal heart that hopefully and normally closes soon after birth. Okay. What that allows for is to actually kind of skip the blood flowing to our lungs, which, why would we be doing that in fetal life? Why wouldn't we be pumping blood to our lungs as much before we're born versus after we're born? What are our lungs doing before we're born? We're not breathing in our mom's tummy, are we? How are we getting our nutrients, our oxygen, and that wonderful stuff? Through the umbilical cord that's connected to mom, right? Okay. So there's really not a need to pump that blood to our lungs. We still pump some, but we don't need to pump all of our blood from the right side to our lungs. Okay. So we actually have two lung bypasses. This is one of them. Okay. Typically, like I said, this closes up. The hole is the foramen ovale, but shortly after birth, it becomes a depression called the fossa ovalis. Okay. Associated with our right atrium is a structure called a right auricle, which is a small appendage. Actually kind of looks like a little ear flap, which we just learned. Fancy term for your external ear is your auricle. This allows for a little bit of extra blood flow to fill up our right atrium. We also see a same thing for the left atrium, so there's a left auricle as well. When our ventricles are not contracting, blood passes down through what's called a tricuspid or right atrioventricular valve, which is located between the right atrium and the right ventricle. We can see a picture here at the bottom where we show at least part of the tricuspid valve. We'll be talking about valves here a little bit more in a little bit. Okay, the left atrium receives oxygenated blood. Once that blood is flown to our lungs and picked up oxygen, it comes back to our left atrium by way of what we call the pulmonary veins. Thickness is about the same as the right atrium, and when it pumps, it ejects blood down into the left ventricle through what's called a bicuspid valve, also known as a mitral or left atrioventricular valve. All those are the same valve. Associated with it, as I mentioned, is a left auricle, which is actually visible here at the bottom of the page. You'll get to see the auricles next week when we dissect our hearts. Okay. Associated with the two atria are what we call pectinate muscles, which are bundles of projecting muscle on the anterior walls of both the atria and the auricles. And we'll be able to see those once we've got the sheep hearts opened up. Okay, the two lower chambers are the ventricles, known as pumping chambers, because they push blood out into some arteries, either the pulmonary arteries to carry blood to our lungs. That's what our right ventricle is going to pump blood into, or your aorta, which is going to receive blood from your left ventricle. And I'll talk about that here in a minute. Let's talk about the right ventricle here first. It is the pumping chamber for the pulmonary circulation. Remember, pulmonary always refers to lungs, so this is the circulation that's going to our lungs to pick up oxygen and unload CO2. Our right ventricle forms a good portion of the anterior surface of our heart, and it receives deoxygenated blood from our right atrium through that right AV valve that we already mentioned. Comparatively, your right ventricle is a lot thinner than your left ventricle, and that's because it's not pumping blood very far. How far away are your lungs from your heart? Not very far, are they? Okay, so that's why it's listed there as a relatively thin-walled, low-pressure system. But the right ventricle is much thicker than both the right and the left atrium. Your thickest and strongest chamber is the left ventricle, the pumping chamber for our systemic circulation using a blood vessel called the aorta, which is the blood vessel that essentially feeds everything, maybe not directly, but indirectly. It's about the size of a garden hose. You can see it nicely here. It comes up and actually curves right back down and runs down towards our legs. And as you can see, blood vessels branch off of it, although the picture's been kind of cut away. We have a picture just like it here on this next page, showing you like these brachiocephalics going to run up towards your head and your shoulders. Common carotids are going to run up into your neck, so on and so forth. Okay. It is about 4 times thicker than the right ventricle. It is capable of creating much higher pressure because it's what we pump the blood out to, like all the way to our fingertips and toes, top of our head. Has to be very strong to do that. Between the right ventricle and a left ventricle is, just like we saw with the atria, a wall, much thicker, much more prominent, what we call the interventricular septum. Once again, inter means between, so between the ventricles. And then shown on the previous page, I mentioned trabeculae carneae, which are little ridges you can see here in our picture. This is actually from a cadaver, so it's very nicely shown. These help with creating extra pressure, and with that comes better blood propulsion or pumping. We find those in both ventricles, left and right. Okay. On the outside, which we don't show here because this is a dissected heart, but we show here in our anterior view and exterior view showing surface features, there are 3 prominent grooves, depressions, or sulci, whatever you want to call them, where we can actually find the boundaries of the different chambers. Encircling our heart near the base to separate the atria and the ventricle is a coronary sulcus. It runs all the way around from front to back and just goes around like a circle. This is where we find that coronary sinus that I'll talk about here in just a second. Running down from that on the anterior side of our heart is an anterior interventricular sulcus. Not very prominently shown here because it's covered with fat, but that's a division between the right ventricle and the left ventricle. We have the same thing on the back side of the heart, which is where you find the posterior interventricular sulcus. Okay, obviously, the anterior is going to be in our anterior view, posterior is going to be in the posterior view. Okay. Now, I've talked a little bit about these different vessels like the aorta and the vena cava. These are described as great vessels associated with each side of our heart, either bringing blood to or taking blood away from our heart to their respective circulations. Now, we'll talk more about arteries and veins in our next lecture, but just to kind of give you a heads up, arteries are blood vessels, think arteries away, taking blood away from our heart. Typically, arteries carry oxygenated blood, oxygen-rich blood, whereas veins carry deoxygenated blood. Once again, I don't really like that term, but there are some exceptions to that rule that exist, which has to do with these pulmonary ones that I'm going to talk about in a second. First two are the vena cavas I want to talk about. We show them here on the next page. The superior vena cava is the main blood vessel, bringing blood to your right atrium from everything above our heart. So your arms and your head, as well as your shoulders and upper chest. The inferior vena cava runs all the way from down by our legs, carrying blood back to our right atrium, dumping it in there. Notice the color of those along with your right atrium. The color blue always denotes deoxygenated blood, whereas the color red we see on portions of this picture denote oxygen-rich blood or oxygenated blood. Okay. Only visible in our posterior view is that coronary sinus. That's, as I showed you, part of or found within your coronary sulcus. This is the major blood vessel that drains our coronary circulation. Your heart is made up of living tissue. It needs its own set of blood vessels, just like your skeletal muscles, just like any other organ in our body. And our coronary circulation provides the blood to our heart, because the blood that's inside the heart is not there long enough for nutrient and waste exchange to take place. Your coronary sinus is the major vein associated with your coronary circulation. And all three of these first ones dump blood back into our right atrium. Your next blood vessel I want to talk about is called the pulmonary trunk. Think of it like a trunk of a tree coming up out of the ground and then branching off. Okay. Your coronary trunk comes up and then forks to form two, what we call, did I say coronary? Pulmonary. Pulmonary trunk then forms two pulmonary arteries. Now, both the pulmonary trunk and the pulmonary arteries here on this next page are color blue, despite the fact that they're both, or all three of them, because there's two pulmonary arteries and a pulmonary trunk. They're color blue, whereas typically arteries are colored red. And here's why. Because the pulmonary trunk and the pulmonary arteries are the only arteries in our body that carry deoxygenated blood. And I would highlight that phrase right there. They pump blood from our right ventricle to our lungs, where we then pick up that oxygen. And then carrying blood back to our heart are the pulmonary veins. And I would highlight this, are the only veins in the body carrying oxygenated blood. Notice their color is red here on our next page. Once again, remember red refers to oxygenated blood. Next one I want to talk about, this is something I've already mentioned, the aorta, which you notice you'll see in several pictures is broken down into different parts, like the ascending, the arch, descending. We'll kind of get into more of that in the next lecture. For now, you just need to know all the same, just as aorta. The artery that receives blood from our left ventricle when it pumps and takes the blood out to our systemic circulation, essentially feeding everything in our body, head, neck, arms, fingers, all the way down to your toes as well. And it's a big dog. And between your pulmonary trunk and your aorta in fetal life is a blood vessel called the ductus arteriosus, another one of those lung bypasses like that hole that's found in our heart. But once we're born, we don't need that because we're not trying to bypass the lungs. So it becomes basically kind of scar tissue known as a ligamentum arteriosum. And he closes after birth, becoming that. But in fetal life, we want to shunt blood from our pulmonary trunk directly into the aorta, kind of bypass the lungs, and that blood vessel will be called the ductus arteriosus. As far as this picture goes, I'm not going to have you worry about anything here, but here, absolutely. And at the bottom of this page as well. So our anterior view, highlight the following. The superior vena cava. Once again, anywhere you see aorta in this lecture, just highlight aorta, which you see several times, ascending, arch, descending, just aorta is fine anywhere you see it. The right pulmonary artery, right pulmonary veins, auricle of right atrium, so you could really write that as right auricle. Also know that, you know, if you draw an arrow right here, that's the right atrium. It would be internally to it, but they've got the right atrium labeled already, so. Coronary sulcus, right ventricle, and inferior vena cava. So once again, superior vena cava, aorta, right pulmonary artery, right pulmonary veins, right auricle, right atrium, coronary sulcus, right ventricle, inferior vena cava. On the left side of the heart labeled, highlight the aorta again, ligamentum arteriosum, left pulmonary artery, pulmonary trunk, left pulmonary veins, left auricle, left atrium, left ventricle, anterior interventricular sulcus, and aorta again. Now, like I told you guys, remember our heart kind of sits at that angle from front to back, which is kind of illustrated really nicely here in our posterior view, where we can see kind of more of the top of the heart. The base is all of this, covered with these great blood vessels. So some good stuff here in this picture. Highlight, again, aorta, aorta, left pulmonary artery, left pulmonary veins, left atrium, coronary sinus. Also highlight coronary sulcus. Coronary sulcus is the depression, the blood vessel that's covering it up is the sinus. So both of them are there. Left ventricle, posterior interventricular sulcus. On the right side of the image, superior vena cava, aorta, right pulmonary artery, right pulmonary veins, right atrium, inferior vena cava, right ventricle. You may go again on this side, tell you what. Okay. Aorta, aorta, left pulmonary artery, left pulmonary veins, left atrium, coronary sinus, coronary sulcus, left ventricle, posterior ventricular sulcus. So everything from aorta down. Okay, we've already mentioned a little bit about them, but on this slide I want to talk in greater detail about these valves. 4 of them total that control the flow of blood through those chambers we just learned about. Okay. Before we do, I want to talk about the fibrous skeleton. So in addition to cardiac muscle tissue, our heart wall also contains dense connective tissue forming the fibrous skeleton of the heart. Fibrous skeleton consists of 4 dense connective tissue rings that surround the heart valves, fuse with one another, and merge with the interventricular septum. which we can see some of those rings here in our pictures at the bottom, where we're showing off those 4 heart valves, kind of the circular white structures around the entire valve. Okay, I'm not going to really get into that. In addition to forming a structural foundation of those heart valves, our fibrous skeleton prevents overstretching of the valves, serves as a point of insertion for bundles of cardiac muscle fibers, and acts as an electrical insulator between the atria and our ventricles. Okay, as each chamber of our heart contracts, it pushes the volume of blood either into a ventricle, which is what our atria do, or out of the heart into an artery, which is what our ventricles do. Valves open and close in response to pressure changes as our heart contracts and relaxes. And each of the 4 heart valves prevents that blood flow is only one directional to prevent retrograde or backwards flow, meaning that we're always pumping blood forward. Okay. 2 types of heart valves are located in our heart. We have 2 atrioventricular valves known as atrioventricular valves, or AV valve for short, because they are located between an atrium and a ventricle. Okay. And what they do is prevent blood from going back up into the atria when our ventricles are going through contraction. On the right side of the heart is the tricuspid valve. On the left side of the heart is a bicuspid valve. Now, both of those also go by, in the case of the right side, the tricuspid is also known as a right AV valve, or if you want to write it out fully, right atrioventricular valve. I usually use the terms tricuspid and bicuspid, but make sure you know them both ways. Okay. Tricuspid is known as the tricuspid, and you can see it nicely here in this picture because tri means what? 3. Tricuspid means 3 little cusps, little flaps, whereas bi means 2, and bicuspid therefore only has 2 flaps. Okay. Now, associated with both of those valves are string-like chordae tendineae, which are these little white strands that connect to muscles that are found on the floor of the ventricles called papillary muscles. Papillary muscles are labeled over here, only one of them, but any of these that are connected to the string-like chordae tendineae. Here's what one really looks like in a cadaver heart. Pretty cool. There's the papillary muscle. There's little string-like tendon structures. What they do is our papillary muscle contracts and pulls on those tendons, preventing our, in this case, tricuspid, or if this was a bicuspid, prevents them from flipping inside out. And that would allow blood to go back into the atria when the ventricles contract. So they help with preventing that backwards flow that I talked about. Okay. The other valves are the semilunar valves located in the outflow tract or exit point of each ventricle, prevent blood from flowing back into the ventricles when they are relaxed. Associated with your right ventricle and the pulmonary trunk, between those is a pulmonary valve. Between your left ventricle and the aorta is the aortic valve. Okay. They don't have any other names, whereas like your bicuspid is also known as mitral or left AV valve. Tricuspid, we also said, right AV valve, just pulmonary and aortic. So that's kind of nice. And associated with them are not the chordae tendineae or the papillary muscles. They don't have those features that we see. Here's a picture showing you kind of a superior view once the atria have been removed, showing you there's not the 3 and the 2, there's just 3 and 3 for those little flaps. Here we show them, this is a cadaver view, essentially showing you the exact same thing that this is showing you. As far as the picture goes, or pictures, this is the one that you're going to want to know. And we see a lot of the things that we've already talked about, aside from those valves. So once again, highlight, starting on the left there, the aorta, superior vena cava, right pulmonary artery, pulmonary valve, right pulmonary veins. The fossa ovalis, remember that's a little depression that forms once that hole called the foramen ovale closes. Highlight that. The right atrium is something you want to know as well, along with the tricuspid valve, right ventricle, and inferior vena cava. Okay, on the right side of the image, everything from arch of aorta, where you just want to know aorta, down to descending aorta, everything on that side. So don't get the top three things. I'm not worried about those, but everything else, absolutely. Very, very, very good chance you'll see this picture again. Hint, hint, wink, wink. Along with those pictures on the previous page. Now, remember, if you had this picture on the exam where nothing was labeled and you had to draw in your own arrows, you don't necessarily have to draw the chordae tendineae in over here. Chordae tendineae are over here as well. These are all papillary muscles, just like the papillary muscle that's labeled over here. These are trabeculae carneae, the little ridges. We find them in both ventricles. So they're labeling some stuff here on the left side of the heart that are also prominent on the right side of the heart. Pictures at the bottom are not important for the exam. Okay, in postnatal or afterbirth circulation, our heart will pump blood into two closed circuits with each heartbeat. Our systemic circulation, which is what our left ventricle pumps blood into, and then the right ventricle, which pumps blood into your pulmonary circulation. Okay, the blood pumped from our right ventricle, as we've learned, is deoxygenated, where it will then go to our lungs to pick up blood, or pick up oxygen, excuse me, and then our systemic circulation is receiving blood from our left ventricle that's oxygen rich. Okay. Looking at the bottom of the page here, we've got essentially the same picture that was on that previous page, along with some numbers to help us trace the flow of blood through the heart, which means actually we're going to leave the heart and come back to the heart a couple times. So starting with number one, we're talking about blood coming into the right atrium. We describe that as deoxygenated blood. Deoxygenated blood comes in by way of the superior vena cava, inferior vena cava, coronary sinus. Right ventricle then pumps that blood through the tricuspid valve, also known as the right atrioventricular valve, into the right ventricle. Then the right ventricle pumps that blood out into the pulmonary trunk, which then forks. Actually, before I say that, it passes through the pulmonary valve into the pulmonary trunk. Pulmonary trunk then forks to form the pulmonary arteries, which carry the blood to our lungs for oxygen to be loaded up, CO2 to be unloaded so that we can breathe it off. That takes place in the pulmonary capillaries. Blood then comes back by our pulmonary veins, oxygen-rich blood into the left atrium. From the left atrium, blood then is pushed down through the left atrioventricular valve, also known as the bicuspid or mitral valve, into the left ventricle, where our left ventricle then can pump that blood out into your aorta through the aortic valve, where it then goes to our systemic circulation, all the way out to our toes and top of our head and that kind of stuff. We give oxygen to the structures that need it. We pick up CO2 that can then be brought back to our heart and eventually back to our lungs to be exhaled out. And so as we show point 10, we're starting the whole process back over again with deoxygenated blood coming back to that right atrium by way of the superior vena cava, inferior vena cava, coronary sinus. If you noticed, I did not read any of that off. I kind of have an advantage. I do this every semester, and I've been doing it for years. So I can rattle that off like nothing. And I don't expect you to rattle it off like nothing, but I do expect you to know the steps involved. So I do kind of expect you to rattle it off like nothing. And here in a few weeks, when you're at Thanksgiving dinner, you can impress your whole family by doing it for them, because that's the coolest thing on earth, right? There will be questions on the exam where I give you, blood is in the right ventricle. What happens next? You'll have to say, okay, it pumps out of the right ventricle through the pulmonary valve into the pulmonary trunk. Or blood passes from the left ventricle out into which blood vessel. So you should be able to describe those steps. A good way to test yourself, once you feel like you know it, take out a blank piece of paper and see if you can write those 10 steps down. That's a great way to tell you yeah, you're ready for the exam. Now, I'm not going to ask you to do that on the exam, but I might ask you a few 3 or 4 questions where I give you a step and then ask you what happens next. Maybe I give you 4 steps and I tell you to order them through 1 through 4. So make sure you know it, because there will be questions for sure on this stuff. Sound good? Okay, we will stop here and pick up with the coronary circulation on Monday. We don't have a whole lot of slides left before we can then move on into our blood vessels lecture. Okay, everybody have a fantastic weekend. I will see you in a couple days.